not bear a political stripe and is the ultimate unifier. It is that cancer sucks. I don't care what political stripe you are, it does. And I'm living it, but, I'm in great hands with the doctors from OHC, and in-house right now, one of the great doctors from OHC, Dr. Tanvi Joshi, she is here to talk about cervical cancer because it's Cervical Cancer Awareness Month. Welcome to the studio, Dr. Joshi. It's a real pleasure having you here.
Well, thank you so much for having me. I'm passionate about this, so excited to be here.
I know you are, and this is, I always look for, bright lights and positive things to talk about when we're talking about cancer. This is one where we can show terrific progress.
Yep, you're exactly right. I mean, cervical cancer is almost an entirely preventable disease.
Yeah, it's going to be like polio someday.
I hope so.
Well, early on when the vaccine came out, and we're going to talk about it a little bit, but early on when it came out, I get much younger man, look at life a little bit differently. I've got a more realistic perspective. The whole idea of giving a young girl a vaccine that is related to sexual activity, first and foremost, seemed to me kind of like a red flag, but I'm completely on board. HPV, the human papillomavirus, which is the cause of cancer, right?
Right, exactly right.
It's everywhere.
Yep. Over 80% of, men and women in the United States have HPV or have had exposure to it in their lifetime at some point.
Right. So you got it. I mean,
exactly.
These deniers out there. I've seen the statistics. It's like overwhelming. You just can't avoid it. So knowing that it's everywhere, getting the vaccine seems the most logical thing since it'll stop women from getting cervical cancer.
Yeah, exactly right.
All right. Well, let us talk about what causes cervical cancer.
Well, as you mentioned, one of the biggest risk factors is HPV, which is a sexually transmitted virus. We already covered the fact that so many women and men in the United States have it, and even across the world. The other risk factors kind of go hand in hand with that. So when I think about risk factors, you think about what could increase your risk of exposure to HPV. And then the other side of it is also what can decrease your immunity and your immune system and your response to HPV as a virus. So when it comes to risk factors, you think about sexual activity that could increase your risk of exposure. Having unprotected sex when it comes to barrier contraception can increase your risk. And then also anything that decreases your immune response, like a disease like HIV or any chronic medication use that causes immune suppression, can increase your risk of HPV.
Or maybe your lymphoma cancer treatments.
That certainly can.
Yeah, okay. I had to throw in a joke about myself in there, doctor. So the HPV-related cases, 90% cervical cancer cases, we know we got that. What are the signs and symptoms? If you're an unlikely, you get diagnosed with cervical cancer, what are women supposed to be looking for so they can hurry up and get out and see their primary care physician or one of the specialists at OHC?
Right. So sometimes cervical cancer can be insidious. It can present without any symptoms. However, there are some common symptoms to look out for, and one of the most important ones can be abnormal bleeding. What I mean by that is it can be, irregular bleeding, so in between your periods or after intercourse. It could be just really heavy abnormal bleeding that occurs with a period, or even after a woman is done having periods, such as postmenopausal bleeding. Other signs and symptoms include pelvic pain, lower abdominal pain, some leg swelling or leg pain, or abnormal and persistent discharge.
All right. So for the woman out there that hears that and going, well, yeah, I've been having some breakthrough bleeding. I just write it off. I'm not going to go see anybody about it. Because I've heard about that my entire life from women, anecdotally and otherwise. What's the risk they are running by not seeing someone and having themselves checked out?
Oh my gosh. I mean, that risk is very high. I don't know if there's a number that we can put on that, but I will tell you that the most commonly the women that I see that are diagnosed with cervical cancer are the ones that have not seen a gynecologist in many years, 5 years, 10 years, or even more than that.
Okay, coming as a no shock to me. Is it an aggressive cancer?
It is an aggressive cancer, but it is a slow-growing cancer. What that means is that we can diagnose it at early stages, even if it develops, as long as you're seeing your gynecologist or a GYN oncologist.
Okay, does it metastasize?
It can metastasize.
Oh, geez.
Exactly.
That's the big concern right there. I mean, it's going to spread to your lungs, your kidneys, your blood system, your bones. I mean, Getting in front of it can avoid so much, and it's curable.
Completely curable. First of all, preventable, and then secondly, curable. Just make sure that you see a GYN oncologist.
All right. Well, you walked into the next subject matter. What about preventing? How do women, what can help them prevent cervical cancer? And don't tell them to never have sex because you know that's not going to happen. That's why 80% of the adult population has it.
Exactly right. That's not going to happen. But actually, there is something that both men and women can do with regards to helping wipe out cervical cancer. And when I think about prevention, I think, okay, there's a primary prevention, which means how can we potentially even reduce exposure to HPV, period, right? How can we prevent getting that virus in the first place? And that is through HPV vaccination. Secondly, the other way to prevent is by getting routine screenings like Pap tests.
Of course.
Now, yes,
I got to ask you about the vaccine.
I'm sure you will. Yes.
Yeah. Let's assume, for the sake of discussion, I haven't been happily married for the last 33 years, and I've been exclusively involved with the same woman for like 37 years.
Sure.
If I had it, is it too late to get the vaccine? Maybe not me at 60 years old, but if there's someone out there, a 20-year-old, maybe sexually active, a lot of them are out here, is it ever too late to get the vaccine, or do you have to get out in front of it, like being vaccinated early before you engage in sexual activity for the first time?
That's a great question. I think that the most useful strategy to prevention of HPV is getting out ahead of it, first and foremost. So get the vaccination. Usually pediatricians and family providers will be talking to patients or parents about this. So HPV vaccination is ideally given to patients at the age of 11 to 12, but it can be given from 9 to 45 years of age. So even if after, exposure to HPV, if a patient has not gotten that vaccination, it's still worth it to get it.
Really? Mm-hmm. Okay, so these are for people beyond the 40-year-old virgin.
Yeah,
okay.
Exactly right.
All right. Does it ever go away?
Does HPV go away?
Yes.
At times. I mean, if you think about it, it's a virus, so the immune system has the chance and has the ability to clear it. However, a lot of the time, the way HPV behaves is that it remains what we call indolent or, undetectable levels because of your immune system.
Hiding in the background.
Exactly. And it can come back, which is what, again, highlights the importance of routine screening.
All right. Now, there's different types of HPV, because my understanding is HPV causes or can cause, like, for example, genital warts.
Right.
So if you got those, you got HPV. But does HPV always result in that, or is there different types?
So HPV has over 50 different strains.
Oh, wow.
But there are certain strains that specifically cause cervical cancer and have been linked to what we call as a high-risk HPV strain. And then there's others, like you said, that can cause just genital warts. And actually, the vaccine that we have here protects you from 9 different strains that have been implicated in formation of warts as well as cervical cancer.
There's another incentive for folks. Do the right thing, get a vaccine. Let's get HPV out of our systems. Now, what are the options for treatments for folks who are diagnosed with cervical cancer?
So really, that treatment depends upon the type of cancer that they have. So in other words, what the cancer actually looks like under the microscope, and then also the stage of cancer, as in how far has it spread.
All right, so traditional things like chemotherapy, radiation, immunotherapy, it's all in the arsenal, but you can deal with it. The earlier it's detected, the more likely it is it's not going to take your life. Any clinical trials? I always have to ask about clinical trials because you have them going on all the time.
Yeah, that is true. So OHC has a robust, set of clinical trials available for gynecologic cancers. We currently have something in the pipeline for cervical cancer specifically. So in the world of, what's next for cervical cancer after it's already developed, we are starting to get more into targeted treatments. So something that's
like CAR T?
Not quite CAR T, but similar to it, though we don't have that specifically for HPV or for cervical cancer.
Yet.
Right.
Work on that low spectrum lymphoma CAR T, all right? Because I don't want to get these damn bags of chemo anymore. Dr. Tanvi Joshi, one of the outstanding physicians you'll find at OHC. Do what I did. To learn more about OHC, if you're concerned, you need a doctor's appointment, you got these symptoms you're talking about, get a second opinion. If you've already got cancer, give them a call. 888-649-4800. That's 888-649-4800. The website, ohcare.com. You'll be in great hands like I am. Dr. Joshi, it's been a real pleasure talking with you. Thanks for bringing the awareness to my listening audience.